Is that the major factor affecting adherence, or are there other factors?
No, there's many factors that play into patient adherence. And certainly, when we look at a patient, it's certainly, they're on a lot of medications now. What's their cognitive ability to manage all those medications? And if they don't have the cognitive ability, do they have a support system in place in their family that can help them keep on track? Certainly, we talk about the financial toxicity and patients being able to have access. We also look at other ways to help patients with adherence, and that could be frequent phone calls by our staff to patients, talking to them about their therapy, make sure they're on track. There's now smart caps with some dispensing systems. We have smartphone apps now that will help patients with adherence and reminders. So there's a lot of technology developing that will help us with our patients in the adherence world.
So the adherence that you're discussing with the smart caps, I'm assuming you mean the cap on the bottle, which tells you that it's been opened and whatever.
And also can remind a patient when to take
Remind the
medication.
patient. That's mechanical.
Mechanical.
But what about other stuff? In other words, patients feel bad when they take these drugs. They just stop them?
Oh yeah, all the time.
You say that with such abandon. Oh yeah, all the time.
Yeah, I mean, patients will just, they're supposed to be on the pill for 21 days. After the first week, they'll feel nauseated and just say, I'm not going to take the rest. And come in and disease doesn't respond and you wonder why.
Yeah, and they tell you, doc, I had to be honest, I only took it like 5 days and I felt like crappy, didn't want to call you.
Didn't want to bother you.
Yeah, and then you just do it, and I was like, okay.
And then you reduce the dose, and the specialty pharmacy sends the patient 90 days of the old dose, which ends up getting thrown out.
Right, exactly.
Sorry.
Sometimes
exactly. They don't tell you. And
what the patients don't, or the specialty pharmacy?
No, the patients don't tell you that they haven't. They don't
like to tell you, right? They're having toxicity.
There was actually a study where they had some kind of monitor on the cap, and they could tell how many patients, and the patient was in this trial, and they looked at how compliant they were. And what they would do is they would miss doses here and there, and then right before the doctor's visit, they would take, they would remove like 10 pills
Oh my God.
to please the doctor, to let the doctor know that they were compliant.
For a moment, I was really worried. They would take 10 extra pills.
No, they wouldn't take them. They would just throw them out.
Remove them away.
So now they put, the newest technology is to put the monitor right into the tablet.
Wow.
So when the tablet is taken, it sends an electronic.
Wasn't
my
the
gosh,
FDA just
that
like
I've
approved
not
one?
Yeah,
Like
they
Yeah, they
approved
just
one.
approved it. I saw that in the paper.
Yeah.
And now people are worrying about privacy.
Right.
You're monitoring my gastrointestinal tract electronically
Put a GPS on it.
with a GPS. Where did you go with that chemotherapeutic pill? Really? Were you near the bank at the time the bank was robbed? These are real issues. People are worried about them.
Yeah, and then you have some people that take extra. So if you
they
were
take
supposed to,
extra pills?
yes. So
Right.
if you're supposed
They
to
miss
take
a
the
dose
pill
and-
3 weeks in a row, they'll take it the extra 4th week. Instead of 3 weeks in a row, they take it 4 weeks in a row. Then the blood counts go down, and it's very dangerous. So you have people taking more or less. It's very.
We used to see that with Ditch. If a half a pill
Right.
is good, a whole pill must be a lot better. That's great.
No,
A lot of people with complete heart block out there.
Or they miss a pill and then they double up for the
Right.
next dose.